Hello and welcome to the Too Much Apparently podcast. If you're new here, this is a podcast for the deeply feeling, overthinking, emotionally overloaded humans who've been told they're too much apparently. And if you're back, thanks for choosing to sit with us again.
We're Alice and Carly, two therapists who are also just sensitive weirdos trying to make sense of life, healing, and our own brains. This isn't a professional advice podcast. It's more like the messy, honest conversations that happen when you finally feel safe enough to say what you're really thinking.
This space is for people like us, the ones who've been called too sensitive, too serious, too emotional, too intense, and have spent way too long believing that it's true.
Okay, on with the episode.
Today we're talking about being too sensitive for this body.
This one's for the people who don't just feel things emotionally, but physically.
The ones whose bodies seem to react more to temperature changes, to certain foods, to stress, to the environment around them.
The people dealing with things like fatigue, pain, gut issues, allergies, or even diagnosed health conditions that don't always seem to make sense together.
Because when we talk about sensitivity, it often gets framed as emotional or psychological or just nervous system stuff.
But your nervous system doesn't just live in your mind, it runs through your entire body.
So today we're talking about how sensitivity shows up physically, from everyday body-based reactions to co-occurring health conditions, and why this isn't just in your head.
Let's get into it.
So I remember years ago coming across, I think it must have been like a blog or something, that was pointing out that when things are in your head, like in your brain is part of your body.
Right.
Your brain is part of your body. So, and not only is your brain part of your body, but your brain initiates, I don't know if this is the right language in which to talk about it. I'm sure you can correct me. But yeah, your brain can initiate these chemical and hormonal responses that then trigger the rest of your body. And I really love this is kind of appropriate because I've just hurriedly eaten a sour sweet as we started this episode and now my mouth keeps watering and watering. But to demonstrate the point that what's in your head is also in your body is imagining chewing on a piece of lemon and that your mouth...
I feel it straight away in my jaw. Mm-hmm.
Yeah. So yeah, even if you're just thinking something, even if it is just in your head, in air quotes, it can have a real body response.
Yeah, our brains are incredibly powerful and still wildly not fully understood. But yeah, that's a good example. The lemon one is good for anyone who struggles with anxiety to either actually have sour lemony sweets or to imagine biting into a lemon. For people who experience a lot of anxiety will know that when you're experiencing a lot of anxiety, particularly when you're working towards panic, the sensation that you feel of the butterflies and the churning, it's your gut kind of turning off. Whereas if you imagine yourself biting into a lemon and you start to salivate and you get those tingly feelings, it prepares your gut for food. So it has to come back on, which means the anxious feelings can slip away. It's a useful technique.
Yeah. It's really helpful to know.
So when we're talking about sensitivity, so often we're talking about it from the perspective of being an emotionally sensitive person. The body-based sensitivity, some people will understand that from a level of sensory sensitivity. So people can understand that people's bodies then might be sensitive to things such as sounds, taste, touch, those kinds of things. But sensitivity can show up in so many different ways in terms of the way in which our own physical body may respond sensitively to things around us. And there's more and more research showing a co-occurrence of certain conditions that are specifically connected with having a more sensitive nervous system and being more sensitive, particularly being neurodivergent. There is such a long list now of co-occurring conditions that can come alongside being neurodivergent. So not every sensitive person will say that they experience their sensitivity on a body-based level, but anecdotally and also with what research is starting to suggest, it means sensitive mind, also sensitive body. Because as you said, for so long, the physical and mental health have been absolutely separated in their own corners. Baffles me as to how that has happened and is still very much happening now. Everything is so separate. medically, in terms of you have this specialty, this specialty, this specialty, this specialty, this specialty. And yet a lot of people who are sensitive experience so many different health issues that spread across many different specialties and are battered about from pillar to post, seeing lots of individual people, rather than looking at everything as a collective and potentially one system. And it's something I'm very interested in because I have multiple health conditions, and health conditions that do commonly seem to co-occur in neurodivergent people. And I know yourself have struggled with various health conditions and things that you're still trying to understand for yourself today.
Yeah. Yeah. It can make for a very frustrating doctor's visit, especially when you've done your own research and you're trying to present all of these connected problems and then being told, well, that's 4 or 5 different appointments that you need to attend for. And I'm like, no, it's one thing.
Right. Yeah.
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 Can I just see the one doctor who can look up all of these different things? Because I think they're all related. And it's like, no, you need to be referred to 5 different specialists.
Yeah.
Yeah, that just in and of itself is so exhausting. But if you have a sensitive nervous system, it just makes sense that that's, as you said, your brain, your nervous system is in your body. So how is that not then going to impact the way in which your body responds to stuff? So, for example, my body can respond very sensitively to various things in my environment. I don't have any specific allergies, but my body can just randomly respond to stuff. And it is easily irritated, easily affected by temperature, changes in temperature, get itchy incredibly easily, skin reactions. If I take medication, chances are I'm going to get the side effects to that medication, or sometimes weird side effects where doctors are like, well, that's not a known side effect of that medication. Well, I'm experiencing it. And sometimes even strange reactions to medical procedures and things like that that I've had. And none of that is something that particularly has a name. But yeah, just what it's like to just do a thing and then, oh, great, now I'm having a reaction to that.
Yeah. And I'm just kind of smiling to myself that we've just recorded the invalidation episode and now we're doing this one. And oh, how much invalidation can you get in healthcare when you've got a sensitive body? Yeah, just so much.
Yeah. Yeah. And how often that I have, even professionals have remarked on my sensitivity, I kind of just expect it now. There was a time, actually, the last time I got my glasses sorted. So I have got an astigmatism in my left eye. So usually the lenses is thicker on this side than the other to, I don't really get the science, but it helps it. But it means the lens sticks out more. And the last time that I got my glasses sorted, the optician said, oh, we can thin those down now. So you can get the thick glass, but then we can make them thinner so it doesn't stick out as much. Is that something that you would like? And I thought, oh, will it make them look a bit better from the side? Sure, go for it. So I had the glasses and then I started to experience a lot of dizziness. It felt like I was looking through like a fishbowl effect. It was making me feel dizzy and sick and giving me headaches. So I had to go back to the opticians, and the first thing they did was check the prescription, and the prescription was absolutely fine. So they were a bit confused as to what might be going on there. And then, somebody else said the only thing that's different is the lens being thinner. And they said, I can't see why that would be affecting it, but we can change it and see. So I was like, well, yeah, fine. That's the only change. So of course they changed it and then it fixed the problem. So when I went back, the optician said, gosh, your brain must be so sensitive to just something ever so slightly being different. But by this point, I kind of just chuckle and roll my eyes to myself because I've heard it so many times. Because if something's going to be changed or different, or I try something new, chances are I usually have annoyingly weird reaction to it.
Yeah. I can't quite tell if that's acceptance or resignation or maybe a bit of both.
Yeah, it's kind of just humorous at this point. I'm like, yeah, I know. Okay. But at the same time, it actually impacts your life quite a lot because you end up with more problems to solve.
Yeah.
Starting a new medication, sometimes I might need to try 3 different medications before I land on one. That's not going to cause me any problems. That's a lot of time, effort, trial, putting up with not nice symptoms, going back and forth to doctors. It takes so much of your time, actually.
Yeah. Yeah, it does. Yeah, I've been on that roller coaster quite intensely for the last 6 or 7 months, backwards and forwards, different medications, different doses. Yeah, it's tedious, and I feel like it can always get to the point of being upsetting, can't it? That you just want to get on with your life. You just want to get on and do things, and here you are having to deal with thing after thing after thing. I don't think I ever thought of myself as sensitive. In fact, even when we started this podcast, I'm still like sensitivity is your word. That's not my word. But when I was at a conference at the weekend, we did a closing ritual, like an ecotherapy closing ritual at the end of the conference. So it was outside, and some people took their shoes off, and I can't remember how the conversation came about, but my friend was saying like her feet are so sensitive, and if it's stood on one little twig, it's oh no, and I'm exactly the same. So when I go to the beach, I have beach shoes now, like little rubber
Right.
beach shoes that you can go in the sea with and walk on the sand with, because I can't. Oh no, I can't. Oh, I can feel it in my body just talking about it.
Walking on the pebbles.
Walking on the pebbles, the shell. I'm like, how do people do that? I don't, even the ridges of the seabed. When
Oh,
I'm
yeah, they can hurt.
oh, they are so painful.
Yeah.
Yeah. So I have beach shoes now. And another thing that I realized a few years ago is caffeine. So I don't like coffee, so I don't drink it very much, unless it's an iced coffee with so much syrup that it tastes like caramel and not coffee anymore. But I can't have caffeine after about 3 o'clock, because if I do, I won't be able to sleep until 1, 2 o'clock in the morning. Yeah.
Yeah, because so then it impacts you so strongly.
Yeah.
Yeah. So it's interesting that I know sensitivity is very much my word and not something that you immediately relate to yourself. And yet there are many things that you share that are sensitive in nature.
I think it's a resistance to the judgment that I feel in the word. I think I've just heard it too many times in a negative way that I haven't quite reclaimed it for
Yes.
myself fully, which feels really weird saying on a podcast that is about, the whole podcast is about sensitivity, really. But, and then on this episode, it feels kind of odd to say that. But there is still some ambivalence in me around, fully reclaiming that for myself.
Yeah.
I do think of emotional sensitivity as a positive thing.
Oh, okay. Yeah. Elements of reclaiming in some places, but not in other places.
Yeah, I just think there's not enough use of the word sensitive as a positive thing. I
Yeah.
think we still don't really hear that enough. Like if I imagine somebody saying to me like, "Oh, you're really sensitive," it's hard to imagine that they're implying like, "Oh, you're really like thoughtful and empathic and in tune with your emotions and other people's emotions." Yeah, that there is still that. So I think there is still that hesitance from me about the word sensitive.
Because you're spot on, it's still not a trait that is felt like it's valued kind of universally. I'm just imagining now someone saying, "Oh, you're sensitive," and being like, "Oh my God, like, thank you so much. That was such a nice day. Yeah, I really appreciate you saying that. Thank you."
Yeah.
It's a bit like if anyone's ever referred to me as a snowflake, I'm just like, "Oh, that's such a compliment. Thank you so much. I really am. I really am."
I kind of don't mind. Yeah, if someone was to refer to me as a snowflake, I feel like there's a bit of a political, maybe left, right, kind of woke bit in there where I'm like, yeah, I am a snowflake. I really care about people. Um, but
Yeah, I
yeah,
bring the blizzard.
yeah, yeah. Mm.
Yeah. I've seen that phrase before. Well, you know what happens when many snowflakes get together? We become a blizzard. So you better look out.
Feels like early 2000s, like teen movie.
Like, yeah, come back.
Yeah.
Yeah. But I thought maybe I could just list out some of the ways in which sensitivity can show up in the body.
Yeah.
So, of course, we've got the sensory sensitivities and how that can show up in the body. So, your physical body reacting strongly to external stimuli. And that can be, genuinely really disruptive. An example of which is my partner and I were going out for a family dinner. And as we got in the car, I was just hit by this really strong smell. And he'd bought a different hairspray that he'd not used before. It was really strong smelling. And I could taste it in my mouth. It was affecting the way that I was breathing. it was starting to give me a headache. So I was literally hanging my head out the window like a dog, trying to hold my hair in place so it doesn't get wrecked up. And at the same time, I'm like, do you ever get annoyed by how sensitive I am as I'm there with my head hanging out the window? It was like, I'm the one that gets affected by it and will be affected by it for hours when the headache lingers. So don't underestimate how much sensory sensitivities can just really impact upon a person. There's then reacting strongly to temperature changes. At the same time as reacting strongly, you may also be quite intolerant to sensitive changes. So things going suddenly hot or things going suddenly cold. You might overheat or be a really, really cold person. And then at the same time with those sudden changes, so for me, sudden temperature changes can cause like chilblains, or I can get really itchiness, I can get red rashes and things like that. But you can also be quite sensitive to atmospheric changes. Some people might know that a storm is brewing just from the atmospheric changes, or that rain's on its way. I'm not talking about in like a magical, it's going to rain. Oh, here we go, rain.
No, I can feel it. When there's going to be a
Right.
storm, I can feel the
Yeah.
pressure. Yeah, it feels like the air squashing me a bit.
Yeah, you can tell the difference in the air pressure and the changes. Or sometimes I will just say the air doesn't feel right today. Can just tell the air is off. The air is different. Might not know what it is, but my body's picked up on it.
Yeah.
You might be more prone to food intolerances and sensitivity. You might struggle with your gut fluctuations between diarrhea or constipation, cramping. Things might be more prone to things like IBS. So that can be a real struggle. Pain sensitivity. If your nervous system is particularly sensitive, you may be more likely to also experience pain on a more sensitive level. Equally, that can go the other way where you might have low pain sensitivity. But yeah, because I have a diagnosis of fibromyalgia, I know from the consultants that I work with that they see high proportions of neurodivergent people coming in for assessments. So it just makes sense that there would be a link there with having a nervous system that begins to respond in an oversensitive manner to pain. And fatigue is much more common, just feeling quite tired by a lot of things. And I don't know if that tiredness is inherent or if that tiredness is because, well, we're probably dealing with way more things. I've only listed literally a few. And if you're dealing with that every day, that's a lot, that can contribute to feeling really sensitive. You might be more prone to things like allergies and asthma, autoimmune conditions, anything that involves the body overly sensitively responding to something. And because of that, we will have stronger inflammatory responses and stress responses in the body. So our body is going to become more responsive to certain stimuli. Yeah, I feel like I could go on and on. I could probably spend the whole episode kind of listing the different ways that it can show up. But they're kind of the more general day-to-day ways within which sensitivity can show up. And then there are the diagnosable conditions that just seem to be occurring quite commonly amongst our population. So things such as fibromyalgia, chronic pain, chronic fatigue syndrome, ME, hypermobility, struggling with joint pain, things like hypermobile Ehlers-Danlos, EDS, POTS, which is a type of dysautonomia, if I say that right, where your body is more sensitive to where it is in space, like standing up, standing still, feeling faint. Then there's a condition called MCAS, which is about your histamine in your body over responding. So essentially kind of having allergic type responses to random things. So when you start to list all of the things off, I don't know, is it any wonder why? I don't know, when I was hanging my head out the window, I'm saying to my partner, like, do you ever get annoyed about my sensitivity? Because I am diagnosed with many of those conditions and I experience many of those day-to-day sensitive responses as well. And it can make life hard living in a sensitive body.
Yeah. And as you're saying all of that, I'm thinking about, I don't know if hyposensitivity is quite the right term. So not responding to things in a way. So one example that pops into my head is underreacting to cold or underreacting to pain.
Mm-hmm.
So I went and stayed in a hotel by myself last year. And as the busyness of everything else was no longer there because I was on my own in a hotel room, I was suddenly in so much pain. And that was really, really interesting. And must have been impacting my mood as well. And it just clicked into place as I was there on my own. And yeah, lots of the kind of sensory things that normally fill up my brain had disappeared. Yeah, that suddenly I was in really a lot of pain.
Yeah.
And I wonder about, like, some people could underreact to anesthetics and things.
Yeah.
I reckon that's related.
Yeah, which
Yeah.
is an important one to know about if you need surgery, that you
Yeah.
need more anesthetic.
Yeah. Yeah,
Yeah.
absolutely. So many different ways. So many different ways. It is frustrating for me, not a medical person, to have known for so long that psychological and physical things are so often interrelated. Not even, well, psychological, neurological, and physical. Maybe there's other words in there too. Yeah, that can be interrelated. And so many people in the medical professions just don't know, just
Mm.
don't seem to have any idea.
Yeah.
Yeah, really
No.
frustrating.
And I think because many of these things are a whole system experience at part of the same thing, but because everything is so split up into its different specialties, there isn't anyone who stops to look at the system as a whole. Everything is just treated as an individual thing. And I've had too many rounds of physiotherapy to count. And I've only really had one physio who's genuinely looked at the whole picture. Whereas other times when I've said, okay, I've got pain here, 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 it's like, okay, well, we'll take you to a physio and they'll work on your neck. Then you can see this physio afterwards who will work on your back. And then this physio can like work on your hips. It's like, but they all impact each other. You
Yeah.
can't sort one out without looking at the others because all of your muscles and ligaments, connect and impact each other in so many different ways. And yet you will go and see this person for this thing and this other thing. In a way, it just doesn't compute like that. Just doesn't even make sense. And so it means even when you do get referred for treatment, the treatment's often inadequate. It's not right. It's not what you need to begin with. And that's really hard when you're someone who maybe has actively tried to help themselves and done the things that you're supposed to do. And it doesn't get you anywhere because it's actually not sufficient.
Yeah.
It was recognized that I just have absolutely no strength. So I was referred for 8 sessions of hydrotherapy at the hospital. And it's like, okay, I don't want to sound like I'm complaining about care that's there. But at the same time, when I have no strength, please tell me what 8 sessions is going to do. It's not going to touch anything. So you can't help but think, I mean, what's the point? And I do it because I want to help myself and it's offered to me. But nothing is long term enough to truly make a difference.
I think you're raising a really, really important point, because I know how much time and energy you invest in researching and pursuing medical help. I know there will also be loads of people out there like me that just think, what's the point? It's too much of a battle. I can't. And are then silently living with all kinds of medical issues that are not getting resolved. Yeah. I recently went to the GP about my back pain, and he asked me how long it had been happening. And when he asked me, I realized that it had been 10 years. So 10 years I have had back pain and haven't gone to the GP because I've had so many prior experiences of being dismissed or being told I'm wrong. The side effects one really made me roll my eyes when you said that. Just so frustrating to start a medication and get a side effect and go back to the GP and say, look, I'm struggling with this side effect. And they're like, that's not a side effect of this medication. Yeah, it is. There's a lot of frustration there. I feel like I want to offer hope, but I guess I'm in a bit of, I saw a reel this morning actually from Amir Khan, the doctor, not the boxer, this morning, talking about things getting in the way of getting health issues sorted out. And mainly he was talking about poverty and how poverty can get in the way. So if you haven't got time, you can't just take time off work to go. And I think that is how it can be. It's repeated appointments and repeated appointments and repeated appointments. And like you say, being referred to one department and another department and another department. It's almost like there needs to be, like a special position created to coordinate like what's happening between all these different things. I think one thing we've not touched on so much is hormonal issues.
Yeah. Yeah.
and how they show up. So PMDD is something that's been spoken about a lot more. PCOS is another thing that can cause so much havoc. I was recently diagnosed with that. Took over 8 months, multiple scans, just, yeah, so much wasted resource. But yeah, I guess just acknowledging the difficulty of, even if you can do all the research yourself and figure it out, that it can be really difficult, and that the healthcare system can be really invalidating. And so you're dealing with all of these issues and then having to steel yourself to battle for care that you just need.
Yeah. Well, it sounds like at some point we should talk about medical invalidation and like medical misogyny, because that has impacted so many of those conditions. Well, so many conditions, but yeah, particularly things like PCOS, PMDD, and those things. And increasingly showing a higher proportion of people in neurodivergent populations. So, what's that about? There needs to be more research and understanding there, because huge populations of people are being let down by by the lack of research. Yeah, and just by a lack of care, because the research hasn't been there, that there are many people that still just don't know. So, hypermobility at the moment is something that is really, I mean, I don't know if it's just because a lot of my social feeds are health condition related, but there seems to be a lot more awareness growing about hypermobility. And yet I am also hearing from people, doctors saying, oh, TikTok, hypermobility is the latest thing on TikTok. Just because you saw it on TikTok doesn't mean you're hypermobile. And yet hypermobility is really broadly not quite well understood. People think it's just bendy joints, and it's not. And in fact, as an adult, you may well have hypermobile joints, but be extremely stiff and inflexible because your muscles have to really tighten up to support your joint that is too loose. So there are so many people that may be hypermobile and struggle with chronic pain in their joints, but wouldn't even consider it's that, because there's still not that much out there or education on what it actually is. But more and more people are recognizing that actually, yeah, they have hypermobility in a way that's not benign, but is actually causing them a lot of problems in day-to-day life, and just in ways that they didn't actually. Well, okay, so this is making me think of myself and a story that I wanted to tell in this episode about another way that sensitivity and my health conditions have impacted me, but I didn't realize at the time. So when I worked at CAMS, Child and Adolescent Mental Health Services, as a nurse, I was part of the assessment team, and we would do all of the child and young people assessments that were coming into CAMS. And on one particular day, I was doing an assessment with the child and the parents, and it was a particularly long assessment, a lot longer than what we normally would. Now, when I am sitting in a chair, I am usually uncomfortable for reasons I've never really understood, but I've always found it uncomfortable. And so I'm either repeatedly crossing my legs over one another, or more often than not, if I can, because it was a sofa type chair, I put a leg up, took a leg underneath me. Since realized it supports my back to do that. So when you're hypermobile, your body has to work way harder just to stay upright because of how unstable it is. So you might often find yourself having to lean, not standing up straight, struggling in dining room chairs, struggling on sofas. So I've since learned that the reason that I sometimes have to sit funny is for that reason, but I didn't know that at the time. The other thing, with you speaking more about low sensitivity, is people's proprioception might not always be very good. So proprioception is the ability to know where your body is in space. What it meant in this scenario is I was not aware that my foot was getting more and more dead as I sat on it. So some people, your body would start to give you signals, you'd get tingles, you'd get the pins and needles, and somebody would adjust. I don't clock that. And I don't know if that's down to proprioception, or when I'm focusing in on something, I don't connect to other things. But either way, I was sat funny, not aware that I was sat in this fixed position for maybe 90 minutes. So the assessment ends and I stand up to let them out. And the moment I put my foot down, my foot is fast asleep. It no longer works.
Oh, no.
And so my foot went down and it didn't work. My whole ankle just rolled underneath me. and rolled quite far in a way where someone else still might have rolled but have been able to maybe self-correct, but mine just fully went. So I was just like, just felt like a bit of an idiot, had to hobble around to let them out, and that was that. And then I was like, oh, great, hurt my foot. Came out quite swollen, came out bruised. Anyway, 3 days later, I think I made a joke of, wouldn't it be funny if I'd broken it? Because there was no way in my mind that I could have broken my foot from it being asleep for too long and then falling over on it. But anyway, I went to A&E and my partner and I literally burst out laughing when they came in with the x-ray saying, yeah, your foot's broken.
My gosh.
And I'd actually
Oh.
only been in the job a few weeks and I had to go off sick because I wasn't allowed to be there with my big boot on. But yeah, had to have a big boot on then for 6 weeks, all just from that scenario. And yet at the time, I had no conceivable way to connect how those different parts of me all came together to mean that in that situation, that's ultimately what ended up happening. I just thought at the time that it was absolutely hilarious that I could just stand up and break my foot.
Oh gosh. Oh, it's bringing back horrible memories of rolling my ankle on 2 occasions. Oh no, I can't even. Ugh.
Yeah.
Oh yeah.
Yeah.
Oh,
I think I've
you.
sprained things quite a lot.
Yeah. Oh my goodness. I'm amused that you can find that hilarious because I'm just like, oh.
I did. I found it funny at the time, actually, because I just couldn't believe it.
Yeah.
I feel like when other people break something, they have a cool story to go along. How did you break your foot? Well, I stood up.
Yeah. Yeah. I suppose there's something there about, dismissing how real something can be. So for you, I guess there was a self-dismissing of like, how could it possibly be broken? I just stood up. But I have had several clients that have been referred to me by their GP who has assumed that what they're experiencing is anxiety.
Mm-hmm.
And so they've been sent to me to cure the problem. And then it's turned out that there was something physical going on underneath. And I suppose I do want to be cautious about this because I definitely don't see it as it's all in your head. But as you said at the beginning, brains are really powerful and stuff that's psychological can show up very strongly in our bodies. So I think it's important to be open-minded about what the thing might be.
Mm-hmm.
But there obviously is a historical pattern of particularly women being dismissed as hysterical, which now seems to be either it's anxiety or you need to lose weight is the other one that often crops up.
Mm-hmm.
Where things aren't being taken seriously.
Yeah. And of course, sometimes it is anxiety, but the problem is when it's just dismissed as anxiety with no checking in on anything. It's kind of just feels like it's just so easy to say, oh, that would just be stress or that would just be anxiety, rather than, okay, let's actually have a look at what's going on here. And actually, there was a time when I was 19, I had to be blue lighted into hospital for something that wasn't actually serious. But at the time, it felt really scary. And actually, I was just in overnight with antibiotics and I was fine and I was discharged the next day, but it was quite frightening. And then to the day, a week later, all of the same symptoms came back. And I was like, oh no, the infection's still here. So I had to take myself to A&E. But this time, they couldn't find anything wrong. And in the morning, they said it was a panic attack. And I was like, what? Like, no, it wasn't. What I experienced was exactly the same as what I experienced last week.
Mm-hmm.
And so for a long time, I kept seeing my GP, and my GP did a lot of physical investigations into what might be going on, which was then very helpful when he turned around and said, we've looked at everything we can. I think we now have to consider the possibility that this is psychological and they are panic attacks. Because they were. But the body, as you said, the mind is so powerful that my mind was able to recreate the exact same symptoms that I had when I was actually unwell.
Yeah.
But except now, nothing was actually wrong. My body was just producing the same symptoms. But the GP took me seriously, did the physical investigations first, and then said, I think we now have to look at this might be psychological. So it was way more easier at that point to then accept, okay, let's do this now and see. And then, of course, going down that route did actually help because, well, panic attacks carried on, but to eventually get rid of them. So the mind is incredibly powerful, but the difference there was that's not what I was just dismissed with to go away and get on with. It was treated seriously.
Yeah. And I think there's something in the phrase of, it's just in your head, I think implies that you can think differently and it will go away. But I think quite often there can be something much more complex. If something is coming up through your body, to me, that suggests there's an unconscious element to it. Otherwise, it would just be a conscious thought in your head.
Right.
If there's a body element to it, my clinical experience is that there's something more complicated going on if it is psychological. Yeah. And just to go back to what we said in the beginning, it's not in your head. Anxiety is not in your head. Anxiety is a full body experience.
A horrible one at that.
A horrible one. Yeah. Yeah. And panic attacks get confused for heart attacks and, feeling like you can't breathe and you're going to die. Like they're really intense. It's not, there's a lot of misunderstanding there. But yeah, certainly from my perspective, if someone gets referred to me assuming that it's anxiety and it turns out to be anxiety, I am never sat there thinking, see, it was just in your head. I'm thinking, wow, how creative of your body to let you know that there was a problem and it couldn't get through in conscious thoughts. So it showed you in the best way that it can.
Yes. Yeah, absolutely. Yeah. I think as a therapist, being mindful of other things at play can be really helpful. And I've always thought that's one of the strengths of me also being a nurse, because whilst people have come to see me as a therapist and not as a nurse, it sometimes means that I can make suggestions, which is, of course, always up to the other person whether they do. But there are many things that can be caused by physical things. It's quite straightforward to have a blood test, to check your body's functioning, to check your vitamin D and B12 and things like that, your iron levels and anemia for if you're tired. I think if you're struggling with various things, it's always quite useful just to check out, could anything physical be going on or anything physical contributing to something that maybe is mental? It can always be a helpful thing to look at or to rule in or out.
Yeah, I think it's essential, even if you haven't got a nursing background, to be considering, what might be going on physically and encouraging people to visit their GP and like you say, have some tests run. It's always better to rule them out than to, press on assuming it's anxiety and actually it turns out to be low iron or, something like that.
Or something else. Yeah.
Yeah.
There's a lot more that I'd like to say on this, but if we were to bring it back to what it's like to live in a sensitive body and therefore how you can learn to better support your sensitive body, what might we say?
It might just be because we recorded the validation episode before this, but the first thing that came into my mind is about believing in yourself.
Yeah.
Is, especially if you're being fobbed off, is to take a friend with you if you can, or a family member to advocate for you in appointments. Or if you can't do that, I often take a piece of paper with some bullet points on it so I can be sure, because my mind will often go blank and I'll feel a bit like I can't push for what I need. So just taking those things to support you with that.
Yeah, I think believing yourself is really important. And just knowing that even if you don't know what's going on for you, even if you suspect what's going on for you, and that could be right and that could be wrong, but knowing that what you are experiencing is real and believing it is really important. Because as you correctly said earlier, even if something is psychological, that's still your real experience and still is something that needs to be understood and explored. Our bodies are just incredibly powerful in terms of what can be manifested in the body, and dismissing it isn't going to get you anywhere.
No.
Unfortunately, it will catch up. It will catch up with you. But we can end up really focusing on trying to fix what's wrong and moving that more towards actually how can we support ourselves. Sadly, some of these things are not fixable, but we can support ourselves or allow ourselves to give ourselves what we need. And I can't tell you how many times I've powered on through stuff when that is not what I should have been doing. So trying to actually listen to what it is that your body needs and being able to provide that for it. So trying to listen earlier where possible. Think about what actually your body needs in order to support it. And I mean, this is a bigger piece of work, but also just like your relationship with your body, because sometimes it can be quite hard to like your body when loads of things go wrong with it and it gives you strange reactions all the time and things to deal with, or you're comparing yourself to what other people can do that you can't do. Like, that's really difficult. This is before we even touch on living in a disabled body, for example, when these things really impact your functioning on a day-to-day basis. And looking into things like chronic illness management techniques, because even if you don't identify or recognize, even if you don't live with a chronic illness as such, there are so many things around pacing and just general support and taking care of yourself and just condition management that actually can be really helpful for a whole lot of different things. It's that spoon theory that we've mentioned on here before, like learning to manage your energy levels. It came about for people with chronic illnesses, but it's actually so helpful for autistic people, ADHD people, different things that people might live with. So don't feel like you can't use tools that are specifically there for certain conditions if those tools actually might be really beneficial to you.
Yeah, it's a really good point. There's really something there, isn't there, about working with your body rather than against it.
Yeah, that's so true. So true. Well, if you've ever felt like your body is too much, too reactive, too sensitive, too unpredictable,
you're not imagining it and you're not making it up. Your sensitivity isn't just emotional, it's physical, it's systemic, it's real. And understanding that can be the first step toward working with your body instead of constantly fighting it.
Next time in Too Complex to Function, we're going to be talking about something that can happen when you've done all the reading, all the research, all the self-diagnosing at 2 a.m.
We're going into what happens when labels are supposed to help, but instead they become another way to confirm that you're broken. When understanding yourself tips over into a spiral that takes you further away from yourself, not closer.
We're also talking about something that we think is really important right now, the rise of using AI as a substitute for therapy. What it offers, what it can't, and why outsourcing your inner world to a chatbot might be keeping you stuck in a very particular kind of loop.
Because there's the difference between insight that sets you free and analysis that just builds a more elaborate cage.
And finally, just to make you aware, we are changing the way we introduce episodes to make them a bit snappier. We just wanted to give a heads up for those who find change a bit jarring, that from next week things will be a little different.
But for now, we'll leave you with this. What might change if you stopped seeing your body as the problem and started seeing it as something that's trying to communicate with you? And what would it look like to respond to that with curiosity instead of criticism? That's all from us today. If this episode made you feel a bit less alone, the best way to help us reach more people is to subscribe, rate the podcast, and follow Too Much Apparently on Instagram, TikTok, and YouTube.
Those simple clicks help other sensitive humans find us when they need it most. Thanks for listening, and we'll be back soon.